So, hello, my name is Chloe Levray, and I am a movement coach, sleep coach, and nutrition coach. I've been in the field for, including my schooling, about a decade. And today we are going to talk about back injuries, back pain. So, most people, a lot of people, I should say, experience some sort of back injury or back pain throughout their life. And that can be from multiple reasons. One, overuse. Another reason could be underuse. So, and not underuse of the back, but underuse of other muscles. When you're sitting, for example, like me, depending on, where your computer is on your desk, you can either be, looking down too much or looking up high too much. And then your body's kind of succumbing to gravity. And so what your body does is you kind of shrink in, right? So all these muscles in the front are now super, super short and tight. And then all these muscles in the back are super elongated, but weak, right? And so when that happens, especially in the hamstrings and the booty, your muscles are weak. So if we have the mid-back that actually should be very loose and mobile and, we should be moving around with our mid-backs, but if that's tight, then either the upper back and or the lower back is going to then loosen up because we have this kind of, this order of mobility and stability in our bodies. So for the back specifically, the cervical spine should be stable, the mid-back should be mobile, the low back should be stable, right? But if that order, or if that is out of order in some sort of way, then, the body's out of alignment. And if the body's out of alignment, then we are more likely to get injured. So one of my mottos is that alignment is the key to effortless movement. So, with that being said, I want to give an example of someone who might come to me with, low back pain or back injury, and, how I would help them get through it. So, say I have this person, a client, can't call them a patient. I am not a doctor. I'm not a chiropractor. I'm not a physical therapist. I have my BA in sports medicine, but I do not have, a doctorate of any kind. So take all this with a grain of salt as well. And it's all about trial and error for your body. So say I have a client who comes to me with, low back pain, chronic low back pain, right? And then, a week later, all of a sudden they pull their backs, like their back spasms, right? So they'll come to me. The first thing I'll do is I'll ask them how they did it. No, not how they did it, but what they were doing when it happened. Because that definitely is a big differentiator, right? So what you're doing isn't necessarily the foundational issue to your injury. So, that person will tell me that they were picking their kid up from the ground, right? And then all of a sudden, back spasm. I'll ask them what movements hurt them in their everyday lives. Does it hurt more in the morning? Does it hurt more in the afternoon? Does it hurt more before they go to sleep? And then I'll ask them, on a scale of 1 to 10, how does it feel right now in this very moment? So after that, then I will take them through a series of movements. And the first couple of movements will almost be like me assessing them. I'm trying to assess in what movements they feel pain and what movements they feel good in, right? After I take them through kind of the initial, couple of movements, then I'll get into kind of the rehab portion. So if it's a low back injury, what we want to do is we want to lengthen and strengthen the hamstrings. We want to lengthen and strengthen the glutes. We want to strengthen the core, and the core not just being, this front part of the body, but the core is a very spherical muscles. It's made up of the pelvic floor. It's made up of your diaphragm. It's made up of, all the muscles, that are, alongside your spine. So if we can start to really strengthen all of those little intrinsic muscles, then your low back will get stronger and be protected mostly. So, yes, I'll take them through, some initial exercises, then we'll go into the bulk of, some rehab. Then I'll ask them, do these still hurt? What do you feel in these movements now? And for the most part, they'll tell me that those movements hurt them a lot less than, they did at the very beginning. So, all that being said, is movement is truly the best rehabilitation for the body. It's not just resting and trying to let it heal that way, sitting on the couch. Especially if it's a back injury, you don't want to be sitting so much, because that's really how you got hurt in the first place, right? Is sitting too much. So when it first happens, when a spasm first happens, all that matters is like, okay, thinking about what am I doing in my life that may have caused this? Not right when it happened, but look at your life overall and assess it. It happened to me like a couple of weeks ago. My back spasmed in the morning. I was literally flushing the toilet. And we all know that's not why my back spasmed. I have a new puppy, and we're sprinting a lot outside, and my body just is not used to sprinting that much. And I definitely wasn't stretching enough as I should have, especially like post sprints. So it was like an accumulation of pressure in my back and of tightness. And then one Saturday morning, I'm flushing the toilet, and all of a sudden my back spasms. So what do I do when that happens? Okay, there's a small little freak out moment, which is fine. You're allowed to freak out for a hot second, but I've learned that your mentality is everything. And the more you think about it and the more that you stress about an injury, the more you're telling your body that you're in danger, and the more it's gonna tense up. And so when this happened a couple weeks ago, the first thing I do is, oh shoot, my back spasmed. Okay, now what? When an injury first occurs, icing is the best way to go, because you're trying to minimize the amount of swelling. And so you're constricting your blood vessels, so you're not allowing the blood to get into, and the liquid to get into the injured area. And so you're really like almost pausing the injury. And it helps with the swelling, and it helps with the pain as well. It also helps with your mentality. So if you're not feeling pain, you're not really thinking about it anymore, right? And that'll help, in the long run. So yeah, I iced it, I rested it. It's okay to rest at the beginning. I will say though that maybe after 2 or 3 days, maybe even 1 or 2 days, assess yourself again. How are you feeling? Walk around. Tell yourself, okay, am I feeling, what is my pain level right now? I was at a 10 when it first happened. Now where am I, 2 days later? And, I would say like if it gets lower than kind of like a 6 or a 7, then I would say start to, maybe even lower than 8. I would say start moving around, start doing those assessment movements, and and then get your your rehabilitative movements in, and then reassess yourself. When the swelling goes down, and when you're about at probably a 6 or a 7, I would say start to heat before movement, because that just helps warm up your body, warm up your muscles, and it loosens everything up. And now we're getting more blood flow into the injured area, and it'll start to heal it. That is my tidbit. Thank you very much. I'm Chloe Levray. So if you like this video, please like it, subscribe, share with your friends, share it on your social media. Follow my sister Hannah on her Instagram and her company name Kaldzar. She is a woman of many talents. She loves to cook. She DJs. She's an amazing movement coach. She's an amazing nutrition coach. And she kind of wanted to put everything all in one. So that's what Kaldzar is. And she has a lot of amazing content coming out. If you found this video super interesting, there's so much more where that came from. And hopefully we will see you soon. Thank you.